Now moving towards another important topic, that how to manage this patient of cleft lip and cleft palate. So basically it is a multidisciplinary approach first of all. Okay, so let's start it. Bismillahirrahmanirrahim. So we will recommend for the plastic surgeon, okay, to do the surgery, orthodontics for the crowded teeth, for the speech pathology problem, for ENTA department, okay, ear, nose, tongue, prosthodontics if they need any prosthesis, and pediatric department, okay, basically, and to rehabilitate the the cleft palate case also. This approach is basically results in aesthetically acceptable, and the end result is without much functional deficiencies, means it reduces those defects, okay, that functional defects has occurred. Now what are the feeding advice to this patient? Cleft palate babies are unable to suck mother's milk, okay, because the intraoral negative pressure cannot be created due to communication between oral and nasal. There is a connection between, which we have told you, between the oral cavity and nose, so the patient cannot suck it. So this patient is given by a spoon with the head end of baby should be elevated with 45 degree. The swallowed air during feeding is released by burping. So when the patient is of the cleft palate, during the feeding they swallow more air, so basically it should be actually released by burping, because then it can cause problems in the feeding also. Okay, now what are the timing of the cleft lip repair? Very important point actually. So it, when the HB is actually more than 10 gram person, and the age is more than 10 weeks, and the weight is more than 10 IB, means 4.54 kg, and TC is actually less than 10,000 per millimeter cube, okay. So basically majority of cases follow this rule, which is called rule of 10, for the treatment of the lip and for also the interior palate repair, okay. We have different types of repair. In unilateral cleft lip repair, mostly used Billard rotation advancement flap and the tension Rendell triangular flap method, okay. This, and then in bilateral it should be used in a single stage or in two stages at the interval of 3 to 6 months. This is actually for two stage repair. One of the method described for this, which is for unilateral, can also be used, and for the bilateral in one stage we use actually view 3 method, which is simple and gives satisfactory results. Other single stage method which give good results are like mallet single procedure and the black procedure. The basic steps of lip repair is, first of all, you have to mark according to the method what you want to do, Miller's repair or tension render repair. Then give the adrenaline solution, which is actually 1.2 lakhs injected in the lip and the labial surface for hemostasis. Full thickness of lip should be incised along or according to the markings that that has been done, and the lip repair is done 3 layers, either the mucosa, muscle, and skin. For better aesthetic results, a cup bow shaped it become horizontal, and the white line continuity should be repaired, and there should be no vermilion notching. Very important. The cleft palate repair is a little bit difficult, means if you early repair it, so it causes the maxillary growth retardation due to any surgical trauma to the center and periosteum, but if you delay it actually defects the speech. The best time is between 1.5 years. Types are basically palatal shelves, you can do it, mucoperiosteal flaps, which is rise from various methods that are placed for the palate repair. You can mostly use a method which is called VY pushback palatoplasty. Steps in VY pushback palatoplasty is actually palate is infiltrated with 1:2 lakh adrenaline. Again, two mucoperiosteal flap are elevated from either side of the palatal shelves, and then the nasal layers are mobilized, okay. The palate is closed in 3 layers: in nasal, muscle layer, and oral. The cleft lip was closed in 3 layers, that was mucosa actually, then muscles and skin. It is actually nasal layer, then it is muscle layer, and it is oral, okay. and in this way we actually achieve this, the lengthening of palate, which is actually V plus T. Hook of humerus can also be fractured to relieve tension in suture, that is land by relaxing the tensor palatine muscle. So in this way you actually treat the cleft palate and lip.